I want to bring more context on the breaking news that Obamacare's repeal has officially gotten underway on Capitol Hill. Joining us now with more is Bloomberg Sahil Kapur, who is on the Hill with more details here. Word crossed the Bloomberg here just a few minutes ago, Sahil, that Republicans in the Senate have released their plans for scaling back Obamacare. What do we know about what they've proposed thus far? And are they proposing here a whole-scale repeal of the law?
So what Republicans in the Senate put out is a budget resolution. Doesn't get signed into law. It essentially instructs the committees of jurisdiction in the House and the Senate to produce recommendations on a repeal bill. That's very important because they're not saying anything about a replacement right now. All they're doing is they're asking the committees of jurisdiction, such as the Finance Committee in the Senate and the Health Care Committee in the Senate, to submit recommendations to the Budget Committee on how to go about repealing the law. It's a bit of a tricky process because they have to do it through reconciliation. It allows them to bypass the filibuster so they can do it without Democratic support, but they can't repeal the entire law. The reconciliation process is reserved for things like taxes and spending, so they can repeal those provisions and maybe throw in some other provisions that are connected to those. This says nothing about a replacement. That's going to come at an unspecified date down the road. What this does is it gives the committees until January 27th to submit recommendations to the Budget Committee, which will then take it from there.
Well, White House Press Secretary Josh Earnest has already come out and said that this is bait and switch and that President Obama will meet with the Democrats tomorrow and discuss how to block the repeal, if you like. What kinds of options are open to the Democrats, Sal?
Well, the best thing they can do is try to make the politics of this untenable for Republicans. And my understanding, speaking to many Democratic lawmakers and aides involved in this issue, is that they're going to highlight very relentlessly the fact that 20 to 24 million people are going to lose their health insurance if this law is repealed without a replacement put in place. Right now, Republicans are far from consensus as to how to replace this law. They agree on some broad strokes, things like refundable tax credits and tax advantage health savings account, and maybe, allowing insurers to sell policies across state lines, but they don't agree on legislation or specifics, and translating those ideas into legislation will almost inevitably create a situation where fewer people have coverage. That is the Democrats' big weapon in this healthcare debate. Republicans have to reorient that debate, reorient that question, and make it about costs, lowering costs and increasing choices. And I think that's the debate we're going to see. That's the fault line.
So, last question here, about 30 seconds left. There's been some plasticity to the position on this that Donald Trump has had over the course of the campaign and now into the transition here. Who is he working with in Congress to draft legislation like this, and how much agreement do you sense there is between the incoming president and Republicans in the Senate?
Well, to the best of my understanding, Trump and his transition team have not been very closely involved with the details involved in this process. There are a lot of disagreements. The key thing to watch will be that there are a lot of disagreements among House Republicans themselves and among Senate Republicans themselves, and sometimes between the chambers and between the committees as to what to do. Everyone's got their own ideas about this. Republicans have had 6 to 7 years to come up with a replacement, and they haven't gotten to the level of details yet.